A good candidate for a penile implant surgery is a patient who, 1, has erectile dysfunction, and 2, desires a penile implant. I usually have my patients try a more less invasive option before proceeding to a penile implant. But if we have discussed together and you desire to move directly to a penile implant procedure, you're a candidate. The good news is most insurances do cover penile implant surgeries. For those patients where your insurance plan does not cover it, there are different avenues that we can go down to help you get it covered. There are 2 types of implants used in the United States. One is a malleable implant that bends, and one is an inflatable penile implant that uses water to inflate the device. The malleable implant is a semi-rigid implant, meaning the device stays partially erect all of the time. When you're ready to have an erection, you bend the penis up so that it's pointing straight, and when you're finished, you bend the penis down so that it's not in the erect position. This device is good for patients who have difficulty with dexterity. The inflatable penile implant is more natural in its nature in that when it is deflated, the penis looks like a naturally non-erect phallus. When you're ready to have an erection, you press on a pump in the scrotum that moves water into the penis to get it nice and rigid and straight. When you're finished, you hit a release button that allows that water to go back away and the penis gets soft again, which is more consistent with a natural erection. During surgery, I take discrete measurements of your penis in order to determine the exact length that you need. No 2 patients are the same, so no 2 implant sizes will be the same. I tailor the implant to be perfect for you, and I make sure to do aggressive measurement to get you the longest length cylinders that are possible. The great thing about the penile implant is that it does not alter your sensation, it doesn't alter your ability to have an orgasm, and it doesn't alter your ability to ejaculate. The only thing that the device does is get the penis firm enough for penetration. The implant is completely concealed within the body, so if you were at the gym and took off your clothes, no one would know that you had anything in place. The implant is made of silicone, which is a safe material to be held within the body. The solution inside the implant is saline, or salt water. The procedure for the penile implant surgery is done between one of 2 ways most commonly. Either an infrapubic incision, which is an incision close to the base of the penis, or a penoscrotal incision, which is an incision underneath the penis going to the level of the scrotum. Through those incisions, we're able to place the cylinders that go inside the penis themselves, the reservoir that goes typically into the abdomen, and the pump that goes into the scrotum. After all the parts are placed, we close up the skin and you're able to go home. The typical recovery time is anywhere between 3 to 6 weeks. Now remember, this can vary from patient to patient. Some patients take less time, other patients take longer, but the usual time is 3 to 6 weeks. My goal is to get you back to intimacy as soon as possible. For majority of my patients, at the 3-week mark, they're able to resume intercourse. For some patients, depending upon the complexity of the procedure, it may take a couple more weeks than that. But within 3 to 6 weeks, you should be able to use the device. The penile implant is a mechanical device. So if you think about parts on your car, they have wear and tear and you have to get them replaced. The same thing with the implant. It typically lasts anywhere between 8 and 12 years before you may need a replacement. The penile implant has the highest satisfaction rate for both the patient and their loved one, and that's because it allows for you to have a reliable erection that lasts as long as you want it to last. The satisfaction rate is between 90 and 95% with the implant. As with any surgery, penile implant surgery is associated with several risks. Risk for bleeding, where you need a blood transfusion, far less than 1%. Risk for infection, depending on if you're a diabetic patient, can be anywhere between 1 and 3%. Risk for injury to surrounding structures, such as your urethra or your urine channel, or your bladder, is less than 3%.